So I'm here to tell you about my latest experience with the Shaare Zedek Medical Center Jerusalem ward called Onco Hematology. And this is going to be really interesting. Well, the hospital itself, Shaare Zedek here in Jerusalem, is celebrating its, I think it's 120th anniversary. And they claim that they are on an international level. It is true for some wards, I have to say, it is true. Some wards at Shaare Zedek are really, really great, working totally professional. And I want to point out the angio department, where I, as a cancer patient last year, got my port. It was the angio department and the surgery, the chirurgia. The angio department is on the second floor, the chirurgia, the surgery is on the sixth floor. I have to point out it's really professional and I don't have any complaints. But, well, the problem is the oncohematology at Shaare Zedek, located on the 7th floor. So when you get to the 7th floor at Shaare Zedek, maybe I should give you some locations before so that you get the message. They have on the 7th floor 2 oncology departments that are separate, but they still work together. So the oncohematology is for hospitalization of cancer patients, and on the other side you have the outpatients. In Hebrew it's called ishpuzium. The outpatient department, where you meet oncologists, you have appointments with oncologists, and you have your chemotherapy. This is a very normal and also professionally run department. So I can, up to a certain extent, recommend the outpatient department, although as a sarcoma patient, I have to say that Shaare Zedek is, in my opinion, concentrating too much on breast cancer patients. Everything is breast cancer, and most oncologists working there are into breast cancer. And many times as a sarcoma patient, I feel like a little lost. I mean, I have a very good oncologist who knows about sarcoma, but there is hardly anyone else, maybe 2 more people, 2 more doctors, who have a little idea about sarcoma. But otherwise, I feel a little lost. Well, today everybody's more concentrating, all the research is into breast cancer, lung cancer, prostate cancer, maybe some intestine cancer, because it's more money. And with sarcoma, as I have, you have more than 50 different kinds of sarcoma, and no one is really putting too much money into research or anything, because it's not the big business. What can I say? This is reality. Okay, coming back to the wards. So on the one hand, in Shaare Zedek, on the 7th floor, you have the outpatient department. That is, as I said, professionally run. They could have more doctors concentrating, as I said, not only on breast cancer, but on many other kinds of cancer. And you have on the other side, separate, the oncohematology. And for the past week, since the beginning of March, I had to go, in order to get my kind of chemotherapy, I had to go to the oncohematology. So I was an outpatient, but I had to stay overnight. So I wasn't in the outpatient department that is closing at 4 o'clock in the afternoon, but I had to be hospitalized for at least 24, 25, up to 30 hours, because my chemotherapy, that is called Yondelis or trabectedin, takes 24, 25 hours. So I had to be hospitalized overnight at the oncohematology. And my first treatment that took place at the beginning of March was more or less okay. It was like I got a really good impression, and everything was arranged quickly, even because I came as a surprise, so to speak. I was due to be an outpatient at the other department, but then they transferred me because of the 24-25 hour treatment to the oncohematology. Fine, everything was fine. I can't complain about the staff. They were nice and everything, so everything took place, and I left the next evening. As soon as the chemotherapy was done, I left. And on the 23rd of March, I came back for my second treatment, and then there was already a problem. I had called in advance twice, the day or 2 days before, and I was told in a more or less rude way that they are full, all the beds are taken, that there is no place for me, and that I actually don't need to come. You don't get your chemotherapy. Don't come, we are full. I was so shocked, I phoned my chemo nurse, the other ward, and she said, no, this can't be, you are going. So I went on the 23rd, as I was scheduled. I'm always scheduled 3 weeks, keep this in mind, 3 weeks in advance at the oncohematology. I'm not coming by surprise. I'm not just popping up. I'm being scheduled like 3 weeks in advance. Everything is arranged a long time in advance. So on the 23rd of March, I showed up for my second treatment at the department, at the ward. And they did have a bed for me. First they made a face, but then the head nurse, keep the head nurse in mind, that worked on that shift, said she has a bed. I just have to wait and check in and undergo bureaucracy. Fine, you always have to do this. And so I checked into the room, and we were like 3 women in the room, and my bed was in the middle, and the beds, in order to keep some privacy, so you can you have a curtain, like to close a curtain to close your private space, so to speak. But these 2 women were, I would say, 75, 80 plus, something like this. And what can I say? They were filling their diapers every hour. And so you can imagine, or you should better not imagine, the smell in the room. They filled their diapers in the whole day, and they were very proud of it. They were not like in a condition that they couldn't go to the toilet. They could have gone, they were just too lazy. And so I was surrounded by smell, like, I have to say it, like shit, for my stay. And after a while, you feel like when you're surrounded by this smell, and those women were laughing, and they were exploiting the staff, they were saying, like, to their relatives visiting them, oh, I filled my diaper, that's nice, get the nurse to clean me up. It was so disgusting, and I felt sorry for the staff. After a while, the staff told one woman, to go to the toilet, because the 2 were able to go. It was not that they couldn't go. They were just too lazy. They wanted attention, and they really enjoyed their time shitting their diapers and getting some slaves, to clean them up. So after a few hours, after a while, I was in the middle. I was the only one using the toilet, and actually one complained about me because she said I'm making too much noise because I'm going to the toilet. You have your pole with the plastic bag with this liquid inside, and so I had to push my pole out, in and out, and in and out to the bathroom, And she was complaining about me, this one woman, because I'm making too much noise. And in her opinion, I should have also filled my pants, instead of going to the toilet. This was her mindset. So after a while, you just feel like you smell like shit, you know, because you're surrounded by the smell. You're constantly surrounded by the smell. And so I thought, like, when I get out of here, you know, I definitely need some fresh air. They also didn't open the window because they said it's too cold. So there was no fresh air coming in. Sometimes I went outside and I enjoyed my time just walking around outside, you know, to breathe. And, well, I mean, the ward is clean. The toilets are getting messed up after a while. But what I really criticize is that it's not a cancer ward. It's an old age home. Many of those patients they're keeping there in their 30 beds or whatever they have. They don't need to be there. They don't need to be there. They are either dumped by their families or they hospitalize themselves because they need attention. They don't have a family, but it's not that they need care, like hospital care, that they undergo treatments or anything. They are just there. Like, for instance, next door, there was a woman, she was really mentally challenged. And this is another point. They put you together with mentally challenged people because they don't keep them separate. So suddenly you as a cancer patient, just getting your chemotherapy, you are surrounded by mentally challenged old people, like dementia, Alzheimer. I don't know what she had, but she was mentally challenged and she screamed her guts out with all kinds of excuses towards the staff, or she was suffocating, she was dying, she was this, she was that. She didn't have anything. She was just screaming. She was mentally totally deranged. And as soon as she started screaming, I think they came with injection to keep her quiet. And then she shut up again for another few hours. And when she woke up, she screamed again. So, you know, when you are in this ward, in this oncohematology ward, you have to prepare yourself that the vast majority of patients is 80 plus. Half of them don't even belong there because they don't need to be hospitalized. They could be at home, but they need attention. They are dumped by their family, whatever. So, and then you have to deal with this mentally. I don't know what, you know. You really have to be prepared. The staff is nice. Not everybody, of course, as I'm going to tell you now. And it's more or less professional. But you know what? When you as a cancer patient come to a apparently cancer ward, you know, you expect, first of all, you expect people of all ages. And you don't expect an old age home. Them, or many, let's say, of them don't even need to be there. And they are there for weeks. Like this mentally challenged woman next door, she's been there for at least 3 weeks, if not more. So last Wednesday, I went for my third treatment to the oncohematology. I was prepared for smell, for, you know, all sorts of things. I was really prepared, and telling myself, you know, I just wait until the chemotherapy bag, until the liquid is done, and as soon as it's done, I'm leaving. I'm out of here. And even if they try to keep me, they always try to convince me to stay another night. I've always said no the previous 2 times, and I wouldn't stay another minute. Even if I crawled out on all fours, I would sign myself out. So I never stay more than I need to. So anyway, on Wednesday last week, I showed up. On the 13th of April, I showed up. And so the clerk at the reception desk was trying to get hold of the head nurse to check me in. So the head nurse was on the phone for a pretty long time. And then she came, but she didn't refer to me. She sat down in front of the computer and tried to look busy. And this took 2 or 3 minutes, and she didn't refer to me at all. And I was just about to say hello. And so the clerk said again that I'm trying to check in. You really had to, you really had to tell her to look at me at all. And then she said, you haven't phoned. You are not on the list. And I said, all the time I phoned, and I phoned in the past. Someone here is telling me that I'm not getting my treatment because there is no bed. And I was told that I can come. So here I am, so to say. And I said, by the way, I don't necessarily need a bed. I can sit on a chair, get the chemotherapy, and as soon as it's done, I'm out of here. And she said, no, we are not doing this. You need a bed. Okay, but they didn't have a bed. And they said, you are not on the list. And I said, how come that my healthcare knows about it and I'm on their list to be here and I'm not on your list? So this head nurse, I felt like immediately she didn't want me there because I said something. And she gave me, in the course of time, many reasons why I can't be there. She had a whole list, and I destroyed her whole list. I was not rude or anything. We weren't. I mean, she had a certain attitude. She was very arrogant. She had a very arrogant attitude towards me. She looked down on people, and she looked down on me. And but because I said something, I'm not like the old folks where some of them don't even know what's going on anymore. So I do say something, and she didn't like that. So I was bothering her, and from the first moment I knew that she doesn't want me there. So she said I should have phoned, and I said, when I phone, you folks are telling me not to come. And I've been booked 3 weeks ago. And then she admitted that I'm on a different list, but not on the first list. She was always going around to try and find some other excuses. So she said, I can sit somewhere or I can walk around or whatever. She's going to contact me. She's going to look if there's a bed. But you also have to keep in mind that many patients hospitalized in this ward don't need treatment. They don't get treatment. They don't even need to be there. They could be at home. So I was waiting for an hour or so, and then I went to the other ward where the outpatients are in order to book an appointment with my oncologist. And it happened by accident that almost the entire hospital management was there. There was the former director of the hospital, Dr. or Professor Halevi, I don't know his whole name. He was there, and at least 5 or 6 other guys from the management. The current director, Offa Marine, was not there, but the previous director, who's around many times. I've seen him many times before walking around in different wards. And so I told them, what just happened to me, that I was scheduled in advance for 3 weeks, and they still couldn't, find a bed and everything. So I told the whole management what was going on. And Dr. Halevi, the previous director, said to me that they are very much aware of the problems at the oncology, and this is why they are there and having a discussion about what is going on at the oncology. Yeah, but but this is all, nothing else happened, so they are discussing. Fine, because right next door, right outside the main building, they are building a whole brand new oncology department, and they want to be the leading oncology in Israel, and of course they want to have medical tourism. So this means that you guys from the States as cancer patients can come to the Shaare Zedek newly built, it's not ready yet, it's going to take a few years, but you can come to their oncology and get the best treatment. So this is the idea, to have medical tourism where you guys from the States pay 50,000, 100,000, whatever dollars to get your treatment. The problem is, at the moment, one department, like the oncohematology, is not on any level. And there is no American, or not anybody, who would pay 50,000, 100,000, 200,000, whatever, not even $5,000 to get treated at this oncohematology, being surrounded by people filling their diapers. And and not even having treatment, or some are having treatment, and whiny people. No, who wants to have this? And many times, this, I have to say, in general for Shaare Zedek, you have many times in all kinds of different departments, that the staff does not speak English, no English at all, or that you have staff members that know some English, but not, not too much. They can't really express themselves, they are very limited. And a friend of mine had to have surgery a year ago, and she got a Russian doctor to talk to, like at the pre-op, and he yelled at her because she didn't really speak too much Hebrew. She's from Canada, she speaks English, and her Hebrew is a little limited. So he yelled at her, this Russian doctor. They have many people, like nurses and doctors from Russia. And so the Russian guy, the doctor, he yelled at her because she spoke English. He also knew some English, but he yelled at her. And you can't be on an international, or you just can't be on an international level where many staff members don't speak English, no sufficient English, and even more, you are being yelled at because you only speak English. You can't, Shaare Zedek has a lot of potential. It's a very good hospital, basically. Many wards. Don't go to this oncohematology ward. Don't go there. You're getting the worst impression, the very worst impression. And, it has a lot of potential. But the way certain wards are run, the way it is run, it is not on an international level. A lot has to change, and especially for the new oncology they're building next door, they have to hire, really professional staff that also know at least English. You know what I mean? You can't concentrate on medical tourism and the staff doesn't speak English, or not too much English, and they can't really express themselves. They're very limited. And and then you are being yelled at. I mean, you pay a high price for being treated, this medical tourism thing, and it's not cheap. And you are paying, I don't know how much, and you are coming and being yelled at because you don't speak Hebrew. It doesn't work. And then this head nurse I had, her attitude, looking down on people, being arrogant. And then I was told, after waiting for 2 hours, she came and she said she has a bed, she's going to make the bed now, but she needs approval from an oncologist to check me in. Fine. Half an hour later, she comes back with an oncologist, also Russian, and he was like a kind of puppet. He had nothing to say. He was just there so that she could argue, that she could list more reasons why not to take me. Then she said, you don't have an approval for your kind of chemotherapy from your health care. And I do have an approval until July, and I showed it to her because I had it written in my email. So I pulled out my smartphone and I showed it to her. So then this puppet doctor, as I called him, because he was on her side, she needed a witness, said that this is a rare kind of, which is true, it is a rare kind of of chemotherapy, and it's too late now to arrange it. It was 4 o'clock in the afternoon, or almost, yeah, before maybe 4 o'clock in the afternoon. And the first time I checked in, it was at 5 o'clock, and I got chemotherapy after 5 o'clock, and this was not too late. Suddenly on Wednesday, I was told it's too late. And so all the reasons didn't really, I could destroy all those reasons they had. And then the nurse told me, actually, you don't really need to be here because you don't need 24-hour care as all the other patients being hospitalized. So basically, a nurse told me that I don't need the treatment, because you don't need this care. You don't need to be here for 24 hours as the others. She said that twice. Of course, he's probably going to deny it now, but she said this twice, that I don't really belong there because I don't need to be hospitalized because I'm not like the others, who are, in her opinion, very ill. Yeah, as I said, many of them don't even belong there, but never mind. She said she gave me her private phone number to phone her in advance, and she said, you can come next week. So what she basically meant is, I'm going to phone her before every treatment to check if Her Royal Highness is checking me in or not. I'm not doing this. I don't want to go to a ward to have chemotherapy treatment where I'm being told, you know what, come Sunday. Then Sunday morning she's going to phone me, you know what, come Wednesday. No, don't come Wednesday, come next week. No, next week, no, we are full, we don't have a bed. Come in 2 weeks, or maybe in 3 weeks, maybe don't come, maybe next month, maybe come next year. So you know what, I'm not going through this every 3 weeks when I need my chemotherapy. I'm not doing this. And I'm not asking this nurse for her royal permission so that she may accept me or may not accept me. Who the hell is she to tell me if I need chemotherapy or not? So I had a talk with my oncologist the day after, and we agreed upon that I'm not going back to this ward. This was, I said, no way I'm going back to this messy, chaotic, disorganized, worst Shaare Zedek ward ever. And I've been around in the hospital. I've been around too many wards. And this is the most disgusting, the most disorganized ward I've ever seen in my life. Not that I've seen too much, but I've been around in the hospital. And this is like a no-go, Don't ever go to this onco-hematology. It's terrible unless you enjoy certain kinds of, smells. So even if I stay on this kind of chemotherapy, I'm going to have a CT scan next week, today in a week, and we will see what the situation with the tumors is. I've got 3 tumors at the moment, 1 nodule in the lung and 2 tumors just below the liver. And we will see what the situation is, and if I stay on this certain kind of chemotherapy, we will find a different solution where I'm going to have it in a normal place, and especially in a clean place, not in a place full of shit. And otherwise, I may change chemotherapy and go on to something else, onto a different kind of chemotherapy. We will see. But I said to my oncologist, it's also a kind of my attitude that I'm, I hate whiny people. I hate people whining and, and longing for attention and, and you have a lot of them, all kinds of ages, not only the old folks, especially the old folks, but, not everybody is like this, but you have many people, you have many whiny people. And I hate this because I'm not like that. I think you have to keep a certain kind of daily routine, which is very, very important, to keep your daily routine, to get up in the morning, to clean yourself. And, I've seen at this oncohematology, old folks start neglecting themselves. They don't shower, or they hardly shower, and they make a mess and whatever. I'm not talking in general. There are also other old folks who are very responsible and very different. But what I've seen there, it's just a nightmare. It's just a nightmare. The positive thing I'm getting out of this is it showed me how I don't want to be. And I'm not this whiny person, this whiny cancer patient looking for attention or feeling sorry for myself. I stand up for myself in a normal way, not in a rude way, and I say whatever I think. I've always been this way. And I'm not whining around. I'm not making other people's life miserable because I'm in this cancer situation. I'm not. I'm very optimistic, and as I said, it doesn't matter if you are sick, if you are healthy, whatever. Everybody, every person in this world needs a goal in life. You have to have a goal in life. And when it comes to cancer, your goal should not be like being healed, so to speak. Of course it should be. But this should not be the goal I'm talking about. You need, besides wanting to be healed or striving for this, you should have a different goal you concentrate on. This is very important, because a person in this world, any person, without a goal is just losing it. You need to have a purpose. You have to give yourself a purpose. Even if it's reading a certain book. You want to read this or that book. You want to go outside. You want to go for a walk. You want to, climb a mountain. You want, whatever. It doesn't have to be like the biggest goal or whatever. It has to be something very simple. And when you fulfill this goal, you're looking for another goal. But you always have to have something in life to focus on. Not only when you are sick, whatever illness you have, not to get over this, be healed or be stable or whatever. You need something else in your life. And don't go for neglectance, don't neglect your own body. Take a shower, brush your teeth, do all sorts of things in life and have a daily routine. And I'm not, as I said, this whiny person looking for attention, or even if I were worse than now, let's say. I would not be whining around, because this is just not my attitude. And apparently at the oncohematology at Shaare Zedek, which is their problem, it's not my problem, but at the oncology, many staff members are used to whiny people. They're used to this, and if it's justified or not. But they look at me and they think, I don't need anything because I'm healthy. I'm not. But I'm just not whining around. I'm not pulling out my little violin and screeching along. I'm not like this. I want to be, my goal is, I have many goals actually. Besides, not having any tumors, I have many other goals. I'm active. Of course, I'm limited because of chemotherapy. I have many side effects. So I'm limited, and I have to get used to this, that I'm limited more or less if I want or if I don't want. I have to sit many times and rest, or I just fall asleep. The general side effects. But you should get alive. And I'm not whining around, laying in bed for 24 hours and telling, people what to do and how to take care of me. I'm not like this. I'm up. You have to get up in the morning, like a normal person. One of my goals is I just want to be like everybody else. I just want to be like everybody else. I just want to have a normal life. I'm not using my illness for, getting attention. I'm not leaving the house and screaming outside, hello, I'm sick, I have cancer, help me. I'm not like this. I don't tell anybody. I'm not walking around and telling everybody what's going on. No, I don't. I may look like it because I'm a little out of shape due to steroids and the hair and everything. Okay, fine. But after this happened on Wednesday, when I was finally told, and I told this head nurse straight into the face that she doesn't want me, that I'm bothering them, and she was like, no, 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 no. Or she would deny anything. She would deny anything because she's got this puppet doctor with her, and he's going to be on her side. But I think that it's very important for you to know what you're getting into if you checked Chas v'Chalila, like into this department. Don't go there. Go to the outpatient department, the Ishbus Yom in Hebrew, and there it's really professional. Don't go to the oncohematology until they have solved lots of problems and maybe, I don't know, told the nurse to work in a different way and get rid of her arrogant attitude, or get rid of her at all and put her somewhere else, because apparently she's not able to deal with cancer patients. You have enough problems in your life, so you don't need anybody, medical staff member, to look down on you. You don't need this. You have enough to deal. You have enough problems in your life with cancer when you are dealing with cancer. But afterwards, in the end, I didn't get the treatment. She did everything to get rid of me. So with a friend, we decided to go, to a restaurant and have a bite to eat. And we did this here in Jerusalem at it's called the old train station. If you're familiar with the location, it's near where I live. I live next to Derech Hebron Street. And so we went to the old train station, which is a cultural center. And there are many restaurants and cafes and things like that. So we went into a very nice Italian place, and we had ravioli. And you know what? This was really good. Not only the food, but it was great to be out in the normal world, let's call it this way, and be among normal people. No smell, no certain toilet smell surrounding you, and just to be part of society. And I really, really enjoyed that. And this is my advice to you. What's really important in life? It's that you have a goal, that you set yourself a goal. As a healthy person, as a sick person, it doesn't matter. Everybody in this world, even if someone homeless or in whatever situation you are, you need a goal in life, or you need many goals in life you can concentrate on, because without a goal you lose a kind of purpose for yourself, not for you, for other people or your surrounding, but you feel like kind of lost. You have no purpose. You are just walking around with no goal. You should always have a goal, always, even if it's something tiny, something small, or even if you change your goal every day, it doesn't matter, but you should always focus on something. That's very important in life. You should keep your dignity, and you should, of course, take care of your body and everything, not neglect it, and you should keep your daily routine. Of course, everybody has a bad day. I have bad days. You have days where you are depressed, or when you worry. Everybody has a bad day. But you should somehow pull yourself together and be optimistic, be positive, even if you are so sick that you have to be in bed 24 hours a day. But you still have to have a goal. And even if you enjoy food or something, and you still have to, somehow live your life. This is very important. This is what makes us human, and you should not lose that. Because then, I don't know, then people may just die or something because they don't see a purpose anymore, which is very sad. So don't be like those people, those patients at the oncohematology. Don't let go and have a purpose, or give yourself a purpose in life. That's my advice. And regarding to the oncohematology at Shaare Zedek, I'm going to find a complaint, an official complaint with the Misrat HaBriut, with the Ministry of Health, because I don't just keep quiet and let go, and that's another goal. No, whatever. But I'm not going back. I'm out of there. So that's it for me. Well, we are having Pesach now, so I wish you Chag Sameach, Moadim L'Simcha, happy Passover, and what can I say? Make the best and be positive in life, and you know, it's better for you. I'm not talking about your surrounding, but it also makes you happy, and this is what's important. Thank you very much for listening, and have a good day.